Hey, so I just want to quickly talk about my experience at UGMC um, when I was pregnant in Ghana. So I saw another creator make a post about how she's going back to America to have her baby. Now, for me, I had an experience at that hospital. It's supposed to be the best hospital in Accra. I had an experience that was just not the best. I mean, I had been there probably that was like my second or third time going. Um, and that appointment, I was actually pregnant, and it was, I mean, no bedside manners at all. Like, at all. I remember the young lady next to me with a curtain was literally in labor, and I just remember how they were talking to her. They weren't patient with her. They were really aggressive with her. Mind you, she's in labor. Her husband couldn't be back there with her. Um, I remember they kept doing cervical checks, and to my knowledge, my sister's a midwife, nurse practitioner. You are not supposed to be doing that many cervical checks because it risks infection. So I just remember them saying, if you don't move your hands, we're going to force it up there. So overhearing that and receiving the treatment that I received at that hospital, I would not recommend anybody have their baby there. Also, you have to know that in a lot of these countries, they glamorize Western practices, which is crazy. Because in the West, we're now starting to embrace holistic Eastern medicine. So I remember one specific midwife nurse was asking me, I was telling her how I wanted to have my baby natural. I wanted to have the baby home possibly. And she looked at me like I had lost my marbles. Like, why would you want to do that? Why don't you just have a C-section? And I'm like, why would I have a C-section for my baby? Like, this is a natural process. Women been doing it since the beginning of time. Why would I cut my stomach open to have a baby? And I remember her just making it seem like it was a status symbol, like wealthy people have C-sections. And meanwhile, in the States, like if you have a C-section, it's because, your baby's in distress and it's an emergency. Now, I do know some people do C-sections because they want to be in control of when the baby's born, etc. But for me, I wanted to do everything natural. So because of that experience, me and my husband chose for me to have my baby in the States. I don't know. Everybody gonna do what they want to do, but that was just my experience at supposedly the best hospital in Accra.